My name is Ashia Lee. I am the Director of Patient Education here at the Arthritis Foundation, and thank you for joining us for our April webinar, Shades of Arthritis, Patient and Provider Perspectives, sponsored by Bristol Myers Squibb. I am really excited to join you guys. April is National Minority Health Month, which is a time to raise awareness about the importance of improving health in racial minority communities by reducing health disparities across the country and ultimately the world. So this conversation is open and honest discussion with our panelists to just better understand some of the challenges that are faced in Black and Brown communities, but also how to be inspired to continue being your true self in the workplace, in the doctor's office, just in the world. So let's go ahead and get started. Let's meet our panelists. So we have Dr. Kwame Mensah. So he is just finished up his appointment, but he's the Arthritis Foundation DC Metro Board Chair, Assistant General Counsel of Oncology Biologics IP at AstraZeneca, and he works very closely with the Global Inclusion and Diversity Council, but his role here today is a juvenile arthritis parent. So you see Kwame right there on the screen. He will be talking with us in a little bit. We also have Dr. Tony Price. He's a researcher at the Georgia Health Policy Center. He has a specialty focus in chronic disease prevention, physical activity, built environment, and health equity. So he's going to be coming to us from the research public health kind of space. We also have Dr. Stephanie Rosado. She's a research and evaluation associate at the Foundation for a Healthy St. Petersburg out in Florida, an adjunct professor at the University of South Florida School of Social Work, an arthritis warrior, and her special focus is social work, psychological aspects of OA, health and wellness, lifestyle outcomes, health equity, and sports social work. So Stephanie has the unique perspective of being both a provider of sorts in the terms of social work, but also as a patient. Then we have Dr. Aaron Stubbs. He's a clinical lecturer at the University of Michigan, and his focus is rheumatology and internal medicine. So we're really happy that he was able to take some time away from his patients and his students to kind of hang out with us. And so we are going to go into some housekeeping. So all attendees have been muted, as you can see. It's not because we don't care about your thoughts and your opinions. It's because we want to make sure that all of our panelists can be heard and they're not quite distracted. So because of that, please use the Q&A function at the bottom of the screen to chat your questions. Our wonderful panelists will be responding in real time as they see it. Because we have a myriad of different voices and experiences, you may get an answer from Kwame or Dr. Price. Following the presentation, we will have a Q&A. So the questions that you have that maybe didn't get answered on screen or during the presentation, you will be able to get those answered at that time. We do apologize if every question doesn't get answered. We will make sure that you have access to information, resources, and if you want to reach out to a particular panelist. Afterwards, you will get a survey. Please tell us what you think about the presentation. Do you want more of this type of information and education? Do you have particular topics that you're interested in? Let us know. We are here to work for you. And so let us know your thoughts. And YouTube, this particular presentation as well will be on YouTube next week sometime, but we have so much information there, including a lot of our past, actually every single past webinar is on there. We have videos about stretching, about working out, all of that. And finally, arthritis.org/webinars is where you can see all of our upcoming webinars throughout the year. All right, so let's go ahead and get started. So we do have a couple of learning objectives that you can plan to kind of some information you can take back with you. So arthritis affects millions of people across the United States, but the experience can vary significantly depending on race and ethnicity. So today we'll delve into the specific challenges faced by Black and Brown communities living with arthritis, but this isn't just about the challenges. Empowerment is key. This is not just to say, oh, okay, things are tough, but let's talk about how we go from things being tough to us speaking up for ourselves to finding a way for us to help other people in our community. So we'll equip you with those resources and strategies to advocate as well as be a whole being in your whole self. So you can expect some expert insights from our panel, actionable tips, and of course that open Q&A to kind of get your questions answered. So Together, we can build an equitable healthcare system, ensure that everyone has access to the resources that they need, and manage their arthritis effectively. So if you are good, let's get started. Thumbs up from my panels if we're good to go. Unique healthcare challenges in the Black and Brown community. So there's a reason why we're having this particular webinar, and there's a reason why there's a Minority Health Month. African Americans rank among the highest in morbidity, and mortality. So Black and Brown, especially African Americans, are dying at faster rates. Black and Hispanic minorities have lower levels of access to medical care in the United States due to higher rates of unemployment and underrepresentation. Elevated feelings of mistrust in healthcare due to the history of experimental research, minimal communication, and lack of transparency, and cultural barriers to treatment, degree of acculturation, language, and immigrant status. Those are some of the big boxes and buckets to where there's some unique healthcare challenges that maybe other groups don't face. So to support these very bold claims, we have some stats. Here's the stats right here. So 20.1% of Hispanics under the age of 65 reported having no healthcare insurance coverage. So if you don't have healthcare insurance, it's very difficult to get any kind of treatment for your arthritis. 21.5% of Hispanic adults over the age of 20 have been diagnosed with diabetes. We know that diabetes is an entryway to a lot of other diseases. And so if 21% of Hispanic adults are already being diagnosed, that shows some of the disadvantages coming right out of the gate. 80% of African American women are overweight or obese compared to 64.8% of non-Hispanic white women. So 80% of Black women are obese. And as we know with arthritis, obesity and just kind of your weight management is a very key indicator to kind of living a healthier life, not just with arthritis, but just in general. And 21.8% in terms of prevalence of arthritis in African American groups. So 6 million people roughly in the US have arthritis. That is a very big number. And so that shows that there's some disparities going on that we need to focus on. But if we want to go from numbers to some more qualitative data, African Americans and Hispanics are less likely to receive pain, treatment, or corrective surgery for arthritis. So think about that, really let that settle in. African Americans and Hispanics aren't getting the pain regimens that they need. They're going into the doctor, they're going into the urgent care centers, and they're not getting what they need. They're not getting prescriptions to kind of help them get through the day as other groups are. Hispanic populations experience faster progression of OA compared to white adults. So once they get OA, it goes very quickly throughout their system, causing them to have a tougher time much sooner. And studies suggest Hispanics might experience higher pain associated with arthritis. So if we're thinking about undocumented immigrants who do not have access to healthcare and those disparities there, they have the pain, they do not have the access to get the help. And so now we're in a really tough predicament there. So I'm gonna stop. This isn't how the story has to end, but we need to know where we are and where we came from to get to a better place in the future. So we're going to have a discussion break right now. So my first question is going to be for Dr. Rosado. If you would please share your arthritis story.
Yes, thank you. And thank you for everyone for joining Arthritis Foundation, for having me. This is a topic that I'm really excited about because I have lived experience in this space. My arthritis story, having these stats on this screen while I'm sharing my story is really like resonating and doing something for me right now. I was diagnosed with OA specifically in my younger adulthood around the age of 20, 21, around there, somewhere around there, right? Probably a little bit earlier than that. I can't really remember. And at that time, I was a collegiate and then professional athlete. So for me to have OA as severely as I had it, doctors were like, hey, this probably started a long time ago. You were probably a child, a teenager. I'm a Latina woman. I'm Puerto Rican. So just looking at the stat that Hispanics might experience faster progression, who knows, right? Like, I don't know exactly what caused my OA. I didn't have any injuries. So, but I always complained of knee pain, even growing up as a young kid. I was also a premature baby. I was born prematurely. Maybe that contributed to it. Some misalignment with my bone structure, things not developing as well as they should have as a premature. These are as a premature child. These are all speculations that doctors, after I had already got diagnosed, had, right? They assumed that this probably started very early on in my childhood, even though OA was considered this old person's disease. Like, doctors were baffled. And so that's a part of my arthritis. But when we talk about being a minoritized individual, because I believe that we are not minority, we are in a system that has minoritized us and has not prioritized us as Black, Hispanic, Indigenous communities and people of color. I grew up in an area that was low socioeconomic status. Maybe the providers my mother was taking me to as a child weren't as good. We didn't have the best health insurance. Maybe that was a cause, for it. So I could speculate all day, but that is a big piece of my arthritis story, even though I don't let it define me now. But having osteoarthritis has really changed the trajectory of my life. It's a part of my story, and now has become a center stone for how I advocate and how I give back as a researcher, as a social worker, as a patient and Arthritis Foundation supporter. So that's a little glimpse. I don't want to take up too much time, but that really is the center of my arthritis story. I was a young adult, very young adult, with an athletic career, both collegiately and professionally, got diagnosed. It stripped me from my career. And I went through some well-being, identity challenges, and so on, which really informed my work in health equity, in research, in social work. And I'll leave that there for now. We can get into more details later.
Thank you so much for sharing. I think there's a misconception that arthritis it happens when you're older. And you said that you were 21. Transparently, I'm 33 and I have an autoimmune disease that affects my hands to the extent that I may have to get some procedures. So it's not just something for older people, it's something that affects along the gamut. So our next person that we'd like to talk to, Dr. Mensah. So please share your story of how you got involved in the Arthritis Foundation.
Great, and thanks for inviting me to be here today. So, as Aisha said, I'm a JA dad. My daughter Nyla was diagnosed with arthritis around the age of 3. When she kind of presented with a couple of swollen joints, and it's kind of hard for a 2-year-old to tell you, what's bothering them. But after a while, I finally got the diagnosis of juvenile arthritis, and obviously being very shocked, not really understanding that kids can get arthritis and how to deal with that. So this was in Chicago. We previously lived there, and then moved to DC when she was about 4. And we were just at our rheumatologist appointment, and there was some flyers on the wall about a camp that was being sponsored by the Arthritis Foundation. And so we just started getting involved. And, since then, obviously, we've been extremely involved with the JA efforts, different camps, going to conferences, speaking at conferences. My wife and I both have been a time on the board and even the chair. So I think it's really important. What we've tried to do is try to bring as much awareness as we can to the community about, what to do when your child has arthritis, giving people information. I'm sure we'll talk about this more, but it's really about access to information and access to folks that have shared experiences to kind of help us guide through the process. So, we've been lucky to have Arthritis Foundation. And I think it's really great that, they're really making efforts to really get into the juvenile arthritis community. It's not, most folks don't know about it, right? Most people think, as we talked about, it's an old person disease. Now imagine being, less than 5 years old and having to take medicine for arthritis. And it's still something she struggles with. She's a very high level athlete. So it's kind of constantly balancing that medication and time off and switches and stuff like that. So, having Arthritis Foundation as a resource has been great for us, and we'll continue to be involved there.
Thank you so much. All righty. So, Dr. Stubbs, let's get to you. So, in your experience, how do health inequities impact patients with arthritis specifically?
Yeah, so health inequities can really impact patients in multiple different ways. Um, it's always good for, which is not something that we really get in medical school, but over time, I think over the last couple of years, people have invested more into determining these things, and um, it's best to look at it from a systemic standpoint in terms of thinking about all the systemic structures that are in place to unfortunately negatively influence how patients receive their care. So for me, when I see patients, I always try to think what, is occurring in this situation or in the patient's life that's inhibiting them from receiving the best care. So, sometimes that may be that, the time that we have clinic, that might be when people are working and they can't get away from their job. That might be that there are certain medications that are causing side effects, and those are the only medications that the patient can afford. It may also be just pure racism, which those things are racism that I just mentioned, but it could just be the fact that patients are not um, being listened to, and they're not um, their complaints are being belittled in a way because of the um, preconceived biases that the providers who they're dealing with, whether it's a medical assistant, a nurse, or a doctor, you know, who is, in the way of them getting their care. And if those people are bringing biases before they even see the patient, then that can negatively impact a patient's health. I could go on and on and on about all the different ways that that can negatively hurt patients, and in particularly in rheumatology, there are many different ways in which there are many barriers to care that we don't necessarily see in other specialties. For instance, a lot of our medications are more expensive. A lot of our medications are require that patients have more lab monitoring. You may need to see your provider more frequently. Rheumatology itself, rheumatologists, there are few rheumatologists to come by, right? In Michigan itself, there's only 200 rheumatologists. We're trying to get people interested in rheumatology, so access to care is a problem, So, so we're dealing with cost, access to care, not to mention the fact that many patients may not have the time to, because they're working, to really do all the things that many patients who are more privileged may be able to do. For instance, call the offices multiple times a day, or emailing people. They may not be as technologically savvy, especially if they're older, or or they're just not as technologically savvy to know how to use the portal to kind of advocate for themselves. So there's just many different ways in which health disparities can negatively impact patients in medicine, based on if they're a minoritized individual, but also in rheumatology itself, there are very specific things that can occur.
Thank you for answering. I'm happy
Yeah,
that you mentioned kind of the rheumatology shortage. Here in
yeah,
Atlanta, it is like a trial and error just trying to find one. If you don't, love your current one, it's very tough to kind of trade out. I've been in
yeah.
that very same experience. So I'm happy you mentioned that. So, Dr. Price, you're going to round us out for this particular conversation. In your opinion, what are the biggest challenges patients from underserved communities face in accessing quality medical care, especially with arthritis?
Perfect. One, I just want to start off. Thank you to you and to the Arthritis Foundation for inviting us to be a part of this. It's really special. One thing that I noticed over the course of the entire month of April, it is the last Thursday of the month, and this is the only thing that I've seen about Minority Health Month this month. So I think it's important to kind of lift that up in conversation. One thing I want to kind of dovetail off of what Dr. Stubbs mentioned, talking about the health inequities. The health inequities oftentimes lead to health disparities that affect minorities and people of color across, wherever they live at. One thing that I'll just kind of lift up in conversation, because I think it's important here in the city of Atlanta, you have two zip codes, one that is north of Atlanta, kind of in that like Buckhead, Brookhaven area. You have one zip code that is south of Atlanta and kind of like that South Fulton area, about 30 miles apart, 20 miles or so apart. There is a 30-year difference in expected life expectancy between those two zip codes within the same city, right? So you have those health inequities that cause health disparities. And I think those are some things that like are challenges for underserved communities. And one thing that is really prevalent in like the public health world is what we call social determinants of health, which are things that are present in everyday life that may not necessarily be overtly connected to health, but influence health. So, two things that I can think of that I think disproportionately affect underserved communities. One is transportation. I think in a lot of communities, there are people who don't have quality access to care simply because they can't get to where care is offered, whether it be because they don't have a vehicle themselves, there is a lack of public transportation. It could be a situation, I think Aaron mentioned this earlier, but your job may present a scenario where you're not able to get away from your work during the work hour to go to seek medical care, right? So that's one piece. And then two, I think establishing and realizing that minority health is equally as important as the health of everyone else. It is not less important. It is equally as important, and that it should be treated as such, right? So I think those two things are really like some big challenges that I've seen for underserved communities getting quality care.
Perfect. Thank you. And to piggyback off of that, so I live in a majority Hispanic town. And if you compare that with the Brookhaven, Buckhead, it is a vast difference in the quality of healthcare, the quality of even just some of the public resources. You're just going to the gym. There's not a lot of gyms over there. It's a food desert, so you can't cook the certain quality levels of food. In Buckhead, there's a Kava, there's a Publix. There are all of these different kind of resources to maintain your health and kind of keep off weight. Try to go to a menagerie of doctors. We don't have that, south of I-20. So I think that is a really good point that you bring up. Alrighty. So we talked about the stats and we've gotten pretty much like why this is important. Let's kind of move on into the importance of cultural literacy in healthcare. So what that essentially means is that your culture, the way that you think, the way that you eat, the clothes that you wear, the music that you listen to, your background can influence how you take care of your health or how you receive health information. And so if that does not line up with the dominant values of a state, a city, of a nation, you then kind of have some misalignment with how you're being treated a lot of times. So at the bottom of the screen, we have a health literacy snapshot that I'm going to read. So a young Latina woman is told by her physician that she needs to lose 30 pounds to lower her risk of diabetes and heart disease. Her family cannot afford a gym membership, and she is too embarrassed to play sports at school, where she is often teased. Her physician told her to simply improve her lifestyle and run outside, but she does not feel safe running in her neighborhood where crime rates have been rising. So that goes along with what Dr. Price was saying. So in order to make sure that our providers are practicing cultural literacy in healthcare, it is a combination of patient-centered care and health literacy. So making sure that you're learning about the diverse cultures of the patients that come into your office, making sure that you are knowledgeable enough to meet their needs and expectations in the exact same way that you may reach anyone's. It is not about Black, brown, purple, or green. It is about, are you human? Do you need help? How can we help you at the top-notch quality of care? It is then also understanding those underserved needs. The young woman in the snapshot, she can't just go work out to lose the weight so that she can have less pressure on her joints. If she lives in a community where she feels unsafe, she's unable to do that. If she doesn't have the money to go to a gym, Memberships are expensive. They can range $50 to $100 a month. She doesn't have a gym that she can go to. So just being a provider that is aware of that, while also putting in cultural alignment, being sure that you are, when you're in the presence of different groups and different people, that you practice empathy, that you are really seeing individuals as people, and that you are continuously learning and studying those that are around you so that everyone can have a great quality experience. That said, let's go into our second discussion points. So, Dr. Rosado, have you ever faced any obstacles in getting a diagnosis or treatment for your arthritis due to race, ethnicity, or socioeconomic background?
Ooh, we about to get into it, y'all. We about to get into it. Yes, all of the above, actually. So let's take it from the beginning, even to my childhood, right? Hispanic family, low income area, mother whose first language is Spanish, right? I'm a child. I can't, or even teen at this point, I don't really know how to advocate for myself, right? In terms of health and, oh, I'm having knee pain, but I don't really know what it is. So having to rely on my non-English speaking mother to be in a doctor's office without translators to kind of get the point across that something's going on with my daughter and I don't know what it is. We need help, right? And physicians just chalking it up to, oh, it's just growing pains, whatever it was, right? So, I mean, that's one aspect of how my ethnicity showed up there, culture, language, and things like that, that prevented me to potentially get an early diagnosis. Let's see, that also has to do with socioeconomic status. And I mean, I've gone back into my patient portal, right? My chart that we all love, right? Maybe not. I don't know if we love my chart or not. And have gone in and seen doctors' notes that misidentify me or misrepresent me. Oh, black patient comes in complaining of knee pain. And I wonder if perhaps I was racializing the society as white or otherwise, if that would have said complaining of knee pain. And so the language we use as providers, as you know, when I go into a doctor's office, is very important. Like I'm hyper aware of that. I've gone into doctor's offices intentionally, like I did my own social experiment where I go dressed in my sweats, you know, hair in a bun, whatever the thing, very relaxed, and get one experience. And then the next appointment, go in very suited and booted, you know, blazer on, slacks, the whole nine, and get a very different experience. So I don't know if that's, you know, my assumption is that I'm being socialized as something that has to do with race or ethnicity or the perception of race, professionalism, and all these things that are rooted in white supremacy. So yes, to answer that question, it has affected my treatment outcomes, how I've experienced the healthcare system dealing with osteoarthritis. And unfortunately, I have to go into my doctor's appointments very hyper aware of how someone or a provider may perceive me, may rush me along, may assume that I have a higher pain tolerance because not only am I minoritized or I'm a BIPOC individual, but I'm also younger and that I can tolerate more pain and just hurry me along.
It's funny that you said that you've done your own kind of social experience, but I was talking about that with my team once before. I've done the same. I go in with my Arthritis Foundation polo on in hopes that, okay, they know that I work somewhere where I may be a little more professional. So does that mean I'm going to be treated differently because I seem like I have a certain type of job or I'm of a higher socioeconomic status? And we shouldn't have to do that. So I'm happy that you mentioned it. So my next question is going to be to Dr. Stubbs. So it is kind of from your own opinion. How are you working to identify and address any implicit biases that you may have when treating patients from diverse backgrounds?
Yeah, that's a great question. So, and to piggyback off of what Rosario mentioned, like I also experienced situations like that as a physician at my own hospital, which not my current hospital at University of Michigan, but um, and I think of myself, when I interact with my patients, it's important to one, step back and see yourself, um, to not necessarily, what's the word, think too highly of yourself in a way. Like it's more about the patient's care at that point. Because like, I've been in similar situations. I had my tonsils taken out in my early 30s, which, as you know, is not a great situation to be in. And, I came in with, you know, I realized, after surgery, my tonsils, the bed was bleeding and I had to go into the hospital. I was like, well, I know I need to go in. So I just put on a sweatshirt and, some slacks and just went right in. Was in the hospital that I worked at the time in Cleveland, they treated me, very poorly and eventually cauterized me without pain meds in the ER. So, and then it wasn't until like I logged in, to one of the laptops and then kind of confused one of the nurses, and she said like, "Oh, who?" It was like, "Oh yeah, I just logged in because I was just like looking up to see, what pain meds were being prescribed." And she said, "Oh, okay. Oh, so you actually work here." And then I was treated completely differently after I explained like who I was. But so it's many situations where it's like I've been a patient as well, and I can see like, okay, I have to understand that a lot of times patients are coming in very afraid, of what they are experiencing, and then also recognizing that, it's not necessarily about my personal feelings, so I want to make sure that I am receptive to feedback as well. So I understand that many providers are not as receptive to that feedback. It's important that you have a good relationship with your provider first. And if that is a challenge, if you feel like that is a relationship that, you can't get past, that might be a situation where you're saying, I might need to find a different provider. Because most physicians should be in a situation where they can accept feedback and they can accept criticism. And I understand that that's not always the case. So for me, I always recognize, as a doctor, it's like I'm going to make mistakes. I'm always challenging my preconceived notions when I go into a room. Like, although, like, I've had certain things happen to me, I also recognize that, I can have biases and I need to check those when those occur. And if you don't have a provider who's not actively thinking like that, who thinks that they're good and, they may have an ego, then it can be hard to kind of work past that. And I also recognize that there are not that many rheumatologists out there, so it's not that easy to make that switch, right? A lot of physicians, I really do think, do need to do the work and kind of do need to, you know, become a little bit more selfless, but not all providers are that way, which is unfortunate. This is also an issue, like a issue when it comes to like health inequity and health disparities, is that, in the best world, patients would be able to switch providers very easily if they had issues with them. And that's just not the case all the time. And that's a systemic issue, as I mentioned, it's not always easy to switch to different rheumatologists because the rheumatologist that you may like is probably 50 miles away, or, and it may take a year to get in to see them, so.
Thank you for your vulnerability, because I know it's not easy to always be able to say like, hey, I'm not right all the time. So we appreciate that. So last question to round out this particular topic. Dr. Mensah, so in what ways have you seen the Arthritis Foundation work to be intentional about ensuring that all who seek our resources will feel seen and heard?
Yeah, no, I think it's one way definitely is events like this, right? I think we're going out of our way to reach out to multiple communities. I know in DC, we worked very hard with the hospital system at Howard University to try to make inroads to communities of color and give them access to access to information about us, about we set up a series of like electronic devices, iPads at clinics, so people can log in and give their information, and we can reach out and contact them, just trying to get more information from folks. But I think we've also been intentional about making inroads in communities. A lot of our sort of outreach has been very intentional, right? Very intentionally saying, who are we not reaching? And if you look at some of the most of the providers, or not providers, most of the patients that receive care, we're just looking at statistically, tend to be, non-minority populations. And again, it's not, as we've talked about, it's not because we're not dealing with these sorts of afflictions. It's because we maybe we don't know where to go. Maybe we don't know who to speak with. So I think AF definitely has been, out there in the community, all over the country, whether it's the walks, whether it's, Jingle Bell Run, all these different efforts to try to get folks the information they need to advocate for themselves. I know we're going to talk about more about that later, but I think that having an organization that's committed to providing information, I think is important because knowledge is power, right? And so I think that's probably where we as a community could, we once we're given the opportunity to get that knowledge, I think we again can advocate for ourselves.
Absolutely. So as he just mentioned, that is something that's happening specifically in DC, but do know all across the nation, we have offices that you can connect with the executive director, you can volunteer. We have resources for you, whether you live in Hawaii or you live in Miami. We hit every space that you need. So he mentioned the importance of education, and that's actually where we're going to go to. So we talked about some of the challenges. We now talked about the importance of cultural literacy. So now let's go into how you can advocate for yourself. So there are three big buckets that really will help you in advocating for yourself, for your parent, for your children, for your spouse, for your partner, for your friend, but most importantly for yourself. So knowing what to expect is one part of making it through the healthcare system, regardless of age, race, color, creed. Knowing that basic information about your health, family history, general information, that can help. So that is education. Personal research can increase your awareness to maintain good health. When we think back on where a lot of our concerns come from, is from a lack of knowing. We don't have the information about what our disorder is. We don't know how to find the information. Sometimes we feel alone. We feel kind of stranded in the sense of, okay, now I have an arthritis diagnosis. What now? But learning about, your disease at the different stages of your journey. Are you early diagnosed? Are you looking for treatments? Are you now able to manage it and you want to give back or you want to help? Where are you? Learn your family medical history. When you go into these doctors' offices, you are able to answer some questions at the very beginning. So now they can kind of rule certain things out. They can start knowing what kind of tests to give you. They can start narrowing down. Because if you go in with your hands swelling, Dr. Stubbs may say, okay, that looks a little bit like arthritis. But if they're able to get some more information and you've already planned yourself out and kind of understanding what may be happening, he can now assist you a little bit more. That can be a great step to prevention or early detection by just knowing family history, kind of being able to track. Health tracking is big in terms of education as well. Okay, so I didn't feel the best today. Let me write down what I ate. What did I do? How did I feel? Keep tracking that. And then when you go to the doctor, you're able to present them with all of their research preliminarily so that they can then go ahead and help. But in order to do that, you need to have trusting relationships with your care team. Because sometimes there is apprehension with being super close with your provider, but you have to think about it. That's one of the most important relationships that you're going to have. And at the baseline, doctors are trying to help you get healthy. So I know there's some preconceived notions. Oh, they're not going to listen to me about my pain. Oh, they may have some biases. I know in my own community, sometimes the thought is, oh, they don't care. They just want to do some research on us. They want to do some studies. They want to do X, Y, Z. And I understand that, especially as a Black woman. I sometimes think if I go into the doctor, are they going to underestimate my pain? As Dr. Rosado said, am I seen as a superhero, especially because I'm younger? So I have to also turn my brain off a little bit when I go into the doctor's office and say, hey, at baseline, this person is trying to help me. And I have to be willing to establish that relationship, be willing to just kind of communicate effectively. not have my guard up. I know that is difficult, but not have my guard up. Make it comfortable for both the provider and the patient. That way we can come together to come up with the best diagnosis, come up with the best treatment and ongoing care. Because if you have a good relationship with your provider, you're more likely to follow their feedback. Because you don't have to take any drug that they say, you don't have to follow any regimen. But if you trust them and they trust you, you guys can come together for something middle ground or the best result possible. And then finally, knowing your rights. As a patient, you have basic rights, and healthcare providers have a responsibility to uphold them. They are of service to you as a patient. When you pay your insurance, you are paying them. They are servants, public servants, much like a police officer, much like a judge. They are here to help you, and they have a responsibility to that. And you should be treated with respect at all times. And you are entitled to information from healthcare providers related to treatments, including the risk. So there are a couple of medicines that may be suggested to you that you don't know a whole lot about. You are entitled to get additional information. You're entitled to get a second opinion. You can ask that doctor. I know sometimes they're busy, but if you need more than 5 minutes on your visit to explain what that biologic is, then you need to advocate for yourself. You have that education. You built that relationship already, and now you know your rights, and you're able to say, hey, can we slow down a little bit? This is my life. Just like this is, you're trying to help me. Your privacy is important. When we talk about going through some of those like experimental phases that happened earlier in our history of medicine, you now have privacy rights. You now have the right to obtain your own medical records. Understanding your rights as a patient is one form of self-advocacy. And here at the Arthritis Foundation, we have an entire advocacy arm located right there in DC with Dr. Mensah, where they are at the Hill regularly, fighting for your rights, trying to make sure insurance is taking care of all of that, all the things that you need. We have where they are doing webinars just like this. They're out in the community. So we are making sure that we're helping as well in the advocacy space. And also in our mission kind of driven space, we have webinars that also talk about how to build relationships with your care team, because that's almost as important as getting the healthcare results that you need. So that said, let's go into some discussion. So let's go over to Dr. Mensah first. What are some of the additional ways you believe that patients can advocate for themselves in healthcare?
Yeah, so as you said, right, it's really about going out of your way to try to ask the right questions to your physician. Do not be afraid. There is no such thing as a stupid question when it comes to your health. Ask every question you know. And also, there's a lot on the internet that's very helpful. You can learn a lot about, disease state, treatment options, but at the same time, remember that it's not a substitute for your physician. There's also a lot of things on the internet that's not so helpful. So use the information you can find online as a tool to kind of help that discussion with your physician, right? Because I think the more informed you are going into the discussion, the better you can kind of advocate for yourself. Also, Arthritis Foundation, right? To give a plug here, unbelievable tool. All sorts of information on our website. You can connect with our local offices. You can connect with, we have connect groups, and every city in America has a bunch of different connect groups for whether it's, if you got a child with arthritis, it's parents. If you're an arthritis patient yourself, other people that have similar indications to yours. So it's really about, building a community of other folks with your, disease indication or similar, and then also like really, going out of your way to learn about, maybe you don't think of yourself as a scientist or whatever, but you can learn about these medicines. You can learn about how they work in your body. Understanding your medical history is super important. So then every second that you spend in that doctor's office, that the conversation is productive and also gets you what you want out of it.
Alrighty, let's hop over to Dr. Rosado. In what ways have you advocated for yourself and other patients? I made sure I picked you for this because I know you live and breathe advocacy. So let's know your thoughts.
Yes, my first thought before I answer that question is I'm very passionate about this education piece because of the very topic we're talking about. Education is great. I advocate for education. I think it can empower patients, but I also think sometimes, right, we harp on it too much, almost as victim blaming. Like patients should not have to educate themselves as much to advocate for themselves in a system. Like the system should be working for the patients. So first and foremost, I just want to highlight and bring that up, that let's not victim blame in the sense that like, oh yeah, if you're educated, you keep educating yourself, you're going to fix the system, because we know that's not true. We've been educating ourselves since the beginning of time, right? So, but I have leveraged education to advocate and improve my own healthcare experience. And I think I have been able to share that with the larger arthritis community and patients. So in what ways have I advocated for myself? Brushing up on medical terminology. I've asked providers, what's your differential diagnosis? Because when I go into a doctor's office and maybe I'm experiencing a different knee pain, I know my body best. I know this might not be OA, but as soon as I walk into that doctor's office, they're like, well, you know, you have OA, that's it. Just come back and see us. We can't do nothing for you. Come back and see us if something new pops up. Well, this is the something new. What did you rule out? When I walked into your doors, what did you rule out to know that this is indeed my osteoarthritis acting up? So that's one question and one piece of medical terminology that has been pivotal in my healthcare experience, because doctors take a moment and be like, well, hold on. All right, let me break it down for you. This is what I ruled out. And it makes me feel better as a patient. Like, okay, they looked and checked off these other things, right? So that's one way, brushing up on medical terminology. So you can interpret what doctors are saying. Some doctors are not good at speaking plain English. It's just, I mean, they try, but sometimes they're not. So you have to be able to decode some of that language. So that has been very beneficial for me. Other ways I've advocated for other patients is through my involvement with the Arthritis Foundation. Like, I feel like, I don't know, me discovering the Arthritis Foundation, and this is not a paid engagement. I am not sponsored by the Arthritis Foundation. Like, I genuinely feel it has helped me heal. It has helped me connect to other patients, and just being able to share my story with other patients has really helped me deal with my own journey and deal with OA, because I see that my story helps others and that people find connection with my story as a young adult with OA who looks like them, sounds like them, talks like them. So those are just a couple of ways that I have advocated for myself or others.
Wonderful.
And Asia, do you mind if I just comment real quick on what
Sure,
something to say? So I do agree with you that we should absolutely expect more from the healthcare system. And I don't think that asking folks to learn more, we're not trying to blame them and say it's their fault. But I do think we have to learn to live in both worlds. Like in the end, the goal is to get phenomenal care for, as someone who's been advocating for my daughter for 14 years now, it's as much as I would love for every doctor I interacted with to give me the best sort of conversation and treat me with respect and understand my level of education, like that is definitely the goal, but it has to be an and, right? We absolutely need to educate ourselves and we need to expect more from the healthcare system. And so I think we can do both. I don't think it's necessarily blaming. We're not blaming ourselves. I'm not blaming our people for not being educated enough. But in the end, everyone should be educated, whether they're black, white, yellow, green, whatever, right? So I think the point is that like we should push. That's why we have Arthritis Foundation advocacy. That's why we're up on Congress talking about changing bills around how we bill folks, how we prescribe medications. All that is happening as well. So keep fighting that good fight, but also understand that the end game is, what am I going to do to make sure that this doctor takes care of me the way I need them to? So just wanted to comment there.
Absolutely.
Yeah, Dr. Mensah, can I just follow up, because I love that you said that, because I think that the reverse is true, and you're alluding to that. Like, through our own advocacy, through our own education, doctors can also learn. Like, they're not perfect either. So I love that you mentioned that and raised that up, because it is true. Through our education and through our own advocacy, doctors and providers can improve their practice.
Excellent. And see, that is an excellent segue, because I'm going to go over to Dr. Price at this point. So we talk about education. We talk about informing doctors, but informing ourselves. So, what are some available resources for particular patients to learn more about their rights in healthcare?
Right. I think that's an excellent question. And I completely agree with Dr. Rosado and Dr. Mensah. I think that bidirectional learning piece is really important in the healthcare system. We as patients and providers in the healthcare system have everything to learn from each other, and being open and honest in that communication, I think, is really important. When thinking about like patient rights, I saw in the Q&A there was a participant who listed a couple of websites like the National Institutes of Health, FDA, AMA, et cetera, et cetera. I think if anybody were to Google like healthcare patient rights, you'll see a multitude of different websites that come up. You can really kind of find anything that fits your bill. One thing that I do want to point out, though, there is a specific patient's Bill of Rights that is provided by the U.S. Office of Personnel Management through the government. On that particular patient Bill of Rights, they have, 8 principal areas of rights and responsibilities. And one of those, which is number 4, it is participation in treatment decisions. Whether you are a patient of OA, you are a diabetic patient, whatever type of patient you should be an active participant in your decision making, in your treatment making process, right? And I think that speaks to what the participant put in the Q&A is if you come with the right questions, you are sitting in the driver's seat to the best of your ability of your treatment plan, right? Which leads me to my second point. If, for example, you are not satisfied with the agreed upon treatment. And I'm going to use this example just because I'm more familiar with this. In the diabetic world, if you are diagnosed with like pre-diabetes, usually you may get one of 2 responses by your healthcare provider. One, we're going to prescribe you metformin, which is going to help take you out of pre-diabetic risk, or we are going to refer you to a diabetes self-management program like the National Diabetes Prevention Program, right? So if you are offered those 2 and they push you in the direction of medication, and that may not be something that you are okay with, you're okay to get a second opinion, which you mentioned earlier, Asia. And I would always advocate for patients who, if you are not satisfied, go to somebody else, because it's you who is the patient and you matter more than their opinion. So that's what I would say. Be an active participant in your own treatment plan. And if you don't agree with what's suggested, go get a second opinion.
Absolutely. I think that is wonderful. And to round this particular topic out, Dr. Stubbs, do you have any firsthand advice on how to build relationships with your provider?
Yeah, I would say that all the things that have been mentioned, I think are good. It is challenging on mine because I do think that a lot of this responsibility does kind of fall on the physician to like build the relationship with the patient. So in flipping that, there are not that many things that I can think of outside of the things that you guys have mentioned. But if I were to add anything, it would be that oftentimes in medicine, we are we can all agree that the structure of medicine is not perfect and it can definitely be improved, especially how clinic flow workflow works. I think that oftentimes patients may not have the best relationships with their doctors when they feel rushed. And sometimes that may deal with the nature of the physician schedule, right? So if, I work at an academic institution, quaternary institution, so it means like, it's a higher level of rheumatology care than what, a community rheumatologist would be seeing. So, a community rheumatologist may see 20 to 30 patients a day, whereas, at U of M, we see more specialty cases. So we have more time for our patients. So we usually see between 10 to 15 patients a day. So that means I just have more time to see my patients. my return visits are 30 minutes, whereas like other rheumatologists, it may be 15. My new patients, I see them over an hour, whereas, other patients, other rheumatologists may see a new patient in 20 to 30 minutes. And that rush nature just automatically messes up relationships. So I think that one, understanding the background of how that works, and then also if that's the case, really making sure you know what time you need to arrive for your appointment. Many patients may not realize that you would want to arrive 15 minutes before your appointment, because your appointment actually that you walk in the door is with your doctor is actually at 3 o'clock, and the medical assistants may need some time with you to ask questions and take your vital signs, and that may take an additional 15 to 20 minutes. So, by the time you see your provider, if you arrive at 3 o'clock when your appointment's at 3, unfortunately, that may leave them less time, and then they may be thinking about the next person, that they don't want to be late for the next person because they got chewed out by the next person because they're always late. So they want to stay on time, which is just not the way the system should work anyway. But unfortunately, that's the hand that we're dealt. So I always say, it's good to, if you can arrive early to your appointments, and then also to see your rheumatologists frequently if you think that there are things that are not being addressed. So I would really advocate for, if you think that your symptoms are unmanaged, or there's still some question about the diagnosis, which is not uncommon in rheumatology, where we're still trying to tease out what's going on. And it may take us some time as rheumatologists to really think through. I mean, the reason why I went into rheumatology is because I actually, I like to think about things, and rheumatology is complicated, and we have to really think things through. And there are many patients who I go home and I'm researching and I'm looking things up, and spending a lot of time trying to figure things out. And sometimes it can take a while for us to really tease that out. That may mean talking with other colleagues. It's which is why, if you need a second opinion, definitely do that, because most rheumatologists, at least in our specialty, asking for a second opinion is not something that we would be offended by, because oftentimes we're asking each other about each other's patients. I'm trying to, um, there are experts within our, even though we're experts in rheumatology, there are experts within experts, so like there might be a vasculitis expert or a lupus expert or a pregnancy expert. I'm the diet expert, so I talk about diet and nutrition. So if that's the case, then, I may already be talking to another rheumatologist, maybe several rheumatologists. So if you want to get a second opinion, I think that's fair, and I wouldn't be offended if any of my patients asked me if they wanted a second opinion. So, but I do think that if you feel that there are inadequacies in your care thus far with your rheumatologist, seeing them more frequently so that they have more time to spend with you, to get to know to get to know you and your symptoms, that may help as well. But also, just the more time you spend with someone, the better, more than likely, the stronger the relationship will be. You likely will have a stronger relationship with your rheumatologist after several visits, as opposed to the first one.
To just wrap us up on that particular slide, we have one more to go. I think I wanted to press in that, much like any interpersonal relationship, the one with your provider does take time. You're going to be nervous and you're going to be kind of unsure on those first couple of visits. But if you have a rheumatologist, you're probably going to be with them for a while. So give it a chance. Give it a chance first, is all that I would add to that. But as we go ahead and try to be full circle, we talked about the unique challenges. We then talked about cultural literacy. We talked about advocating for yourself. So now let's talk about being authentically yourself always. So being true to you. So one of the most significant benefits of embracing your culture is just being able to appreciate your heritage. You get to develop a sense of identity and purpose. So even me doing this particular presentation, I was a little worried. I said, okay, do I need to wear a suit? Do I need to maybe change my hoops out? I do have braids. I have my gold jewelry. I have my nails. And it may seem silly to say, but those are things that I do have to think about as a Black woman in the public health space. But I'm so grateful to have a team that allows me to be true to myself, because what I look like in my background and where I come from is not indicative of the work that I put out. And it doesn't matter how I look to the public, I still deserve to get treatment in the doctor's office, whether I work at the Arthritis Foundation, or I'm unemployed, or if I don't speak English, if I look a particular way. And you should not have to hide who you are, hide the foods that you eat, hide the music you listen to, hide the way you dress, how you worship. That is what makes you you. And you deserve quality care regardless of any of that. That is your right as a human being. So be true to yourself at all times. And seeing yourself in the doctor's office. I really do appreciate being able to go to a doctor sometimes, not all the time, but going to a doctor and feeling like we have something in common. I feel like, okay, Dr. Stubbs may listen to me when I say that I have some pain, but not even just that. When we talk about there being kind of like shortages in rheumatologists, being able to see a rheumatologist that looks like you, whether they're Hispanic, whether they're African American, maybe they're from a whole nother continent. I now know it's possible. Now, Dr. Mensah's daughter is able to see that you can have these particular jobs. So seeing yourself in a doctor has proven greater satisfaction of care if the doctor was the same race or ethnic background than if the doctor was of a different background. Research suggests that patients choose a doctor of the same race because they feel greater comfort and trust, like I said. Only 6.4% of all rheumatologists in the US are Hispanic. Only 6.4, and it gets even lower with Black. 3.8 are Black. So shout out to you, Dr. Stubbs, for being one of the 3.8% of Black rheumatologists. So we really appreciate that. And then finally, empowering yourself through knowledge. So here at the Arthritis Foundation, a couple of you guys suggested our connect groups. We have an African American connect group. We have a Hispanic connect group. We have military connect groups. For literally any category that you can think of, we have a connect group where essentially you get together with like-minded people with like-minded experiences and talk about not just arthritis. We have where you can talk about diets. You can talk about, hey, here's my pain. Here's some hacks that I'm using. Here's the treatment that I'm on. Okay, my spouse or my partner doesn't understand what happens in a flare. How are you guys communicating? So we do have that. But empowerment through knowledge is also just the way that you're learning to take care of yourself. How are you eating? How are you exercising? How are you advocating for yourself? How are you making healthy decisions that'll benefit you in the long run? So be authentically you always. You don't have to turn yourself down. You don't have to wear a suit to the doctor's office. Be who you are, because that's most important. And you being different is the way that we nudge forward in terms of really appreciating diversity. And so that said, let's get into the discussion. After this discussion, we're going to open it up to kind of just, if you guys have any general questions, please also ask in the Q&A. After this, we're going to kind of do some wrap ups, and then we're going to release it to you guys. But Dr. Stubbs, you kind of mentioned about what made you go into rheumatology, but what is your favorite part of practicing rheumatology?
It's definitely the patient interactions. I really am happy that I decided to stay in academic rheumatology simply because I do have, now granted, I will say in academic rheumatology, you make a lot less, but you have more time with your patients. So, so for that reason, I have really good relationships with my patients, and that can be very rewarding. Also, I do think it's always great when you can see a patient for the first time, maybe the second time, and the third time you see them. They're really happy to see you because they're feeling much better. They even brought you cookies, or they brought you, you know, one of my patients is an artist, and so they made me something. So I was like, love those moments. So even, and so I would say like, yeah, I definitely, working in academics, and you definitely take a pay cut. It's preferred. I enjoy it. Also in academics, you teach, um so you get to teach the next generation of rheumatologists to make sure that they're not burned out, and make sure, and also trying to, convince them to, hey, definitely if you're feeling burned out, talk to somebody about that. Because there's too many burnt out doctors who are unfortunately um negatively impacting their patients because of that. Um, so yeah, very, very happy with rheumatology. So
Excellent.
Yeah.
Alrighty, Dr. Rosado, how important is it for you to see yourself in your providers?
For many of the reasons that you said earlier with the stats and like feeling satisfied and feeling seen and heard and like related to, it's very important to me. But I think even more important is having a provider that makes me feel like they see me within them. When I go in to see them, they're like, this could be my daughter, my sister, my whatever, and this is how I'm going to treat her, you know? But so I think, again, we go to that bi-directional relationship that was spoken about earlier. It's important for me to see a provider that looks like me because I feel seen, heard, or whatever. But if not, right? Because someone might live in a rural area and they might not have a rheumatologist of color in that area. If that's not possible, right? That provider sees that person within them so they care for them in the best way that they can.
Absolutely. Thank you for sharing that. So, Dr. Price, I see something in the chat that is talking about code switching, which is leading me to your question. How do you remain authentically yourself in public health?
That is an excellent question. This is going to sound very funny, but it's very real. One of the organizations that I'm a part of, the Emerging 100 of Atlanta, we mentor students in Southwest Atlanta every month. We go down there, we have character development sessions with them, and we try to pour into them, right? Because that's something that we wish we would have had growing up. One way that I try to be authentically myself is in those types of scenarios, if I have to be anything other than a Black man, I am doing other Black men a disservice, right? And I think about that in the context of there are not many Black men in public health. One, there are even fewer Black men in public health with a terminal degree. So I have to be myself all the time. And the funny, maybe not so funny part of this, one way that I was able to connect with a student at the school we mentor at is I have what you would call like the Atlanta beard, which is my beard on the side is one length, but like my goatee is a little bit longer than the rest of my beard. And a student there had the same type of beard, right? So he pointed it out to me because I got a little gray streak right here. He pointed it out and we were able to kind of like laugh and joke about it, but it was the gateway into a conversation about career development, right? So just by having something that we could identify with as Black men, we could possibly have another Black man in public health in the next 5 or 10 years or so.
Absolutely. I really appreciate that. I saw Dr. Mensah laughing about his gray in his beard as well. That said, we're going to go ahead over to you. Dr. Mensah, in what ways do you empower your daughter, both culturally and medically?
Yeah, so definitely, as I mentioned before, she's a pretty high level athlete and has always been very into sports. So I think that there are kind of two ways we could have gone with her as she was coming up, dealing with arthritis. There was a very much we're going to shield her and protect her and say, hey, let's take it easy. Let's make sure that we're not doing too much. But I think we kind of went the other way and said, look, like you have this, but there's nothing that can stop you, right? We're going to work with your doctors. We're going to make sure you understand what's going on. We're going to push your doctors to help you, but we want you to succeed in everything that you go after. And so that's been her mindset ever since she was little. And honestly, to be honest, it's almost times to the detriment, right? Sometimes we have to kind of pull the reins back on her and say, it is okay to take a break. Like you're not superhuman, like it's okay. But I think that she doesn't feel like she has any barriers on her because of her disorder. And I think that's been super important for her ability to allow the doctors to treat her and to allow her to have a positive attitude and not feel that she's being held back. So we've always tried to instill that in her. And then when we meet other kids that have arthritis and she meets other kids with arthritis, it's kind of the same thing, right? So it's really a pay it forward and making sure that, when she goes to arthritis camp and sees other kids there, like trying to be a good example for them and just continuing to live her best life. That's been really important for us.
Excellent. So, guys, we are going to summarize everything that we talked about. So, first thing, be proud of your heritage. Who you are is perfect. You do not have to dim your shine to get quality health care. Educate yourself on your disease. Yes, it is a part of your provider's responsibility to make sure that they are knowledgeable about you, your disorder, and your culture, but also make sure you know what you're going into as well. Know your rights. You are protected. You deserve to know exactly what's going on. And so fight for that and build trusting relationships as you do with any interpersonal relationship. You need to make sure that there is, on both ends, that there is communication that can help you get to that center goal of being your best self. So, what I'm going to do is stop sharing and just try to answer a couple of questions to our group before we close out. I know we have about 2 minutes. So, these are going to be quick, rapid fire. All righty, Dr. Price. Can mindfulness or other practices like yoga, Pilates, walking, or swimming help arthritis pain? Go.
Absolutely. Any movement is better than no movement. Yoga is something that I do myself. I do it right in my living room. I pull up a video, move the living room table, do it myself. And it certainly helps with the mental process. Dr. Rosado, you could probably identify with this as well. Going through the dissertation process with school, you got to take care of your mental health. Yoga was one of those things that helped get me across the finish line. So absolutely, I would recommend yoga, swimming, walking, anything that feels good to you. Absolutely.
Perfect. All righty, rapid fire to Dr. Stubbs. Question from the audience. How do you manage chronic pain without providers labeling you a drug seeker?
Oh, good question. So, and again, I would say that it's not something that, it's on the patients to really do anything about that. If that's somebody who's bringing biases in, I don't think you should necessarily change yourself. Um, but how do I manage chronic pain? I tend to look at the full person. I try to um, first find out, is there an inflammatory process going on, and addressing it that way. A lot of times my patients, first thing they want to know is like, I really don't want to go on opioids. And it's like, that's, we're not, not definitely not trying to. So I feel like there's sometimes patients have this fear that you're going to think that they're looking for chronic pain meds. And, really, in rheumatology nowadays, we don't usually use um, opioid opioids as much anymore, as much as we use other anti-inflammatory medications. So, but yeah, I think that just having open, honest conversations with your doctor, and then also just establishing what your goals of treatment are early is very helpful because that's something that, sometimes even doctors may forget to ask is what do you actually want? Do you want medications or do you want to talk about diet and nutrition? Do you want to talk about other avenues of addressing your health? And I think having that conversation early in the first visit is useful.
Perfect. All righty, Dr. Mensah. How can I still eat all of my delicious cultural dishes while still trying to live a healthy arthritis life?
Yeah, no, I mean, I think there's a lot of studies out there related to food and arthritis, and I think in the end it's just about having a healthy, balanced diet. I think one thing we found is that there's not one way to eat, right? There's thousands of different cultures around the world, and they all eat different kinds of food. So eat when you enjoy, but make sure that you're doing what's right to keep your health at an optimal level. I think because the healthier you are, the easier it's going to be for you to deal with your condition. All right. So eating healthy, that doesn't mean eating salads every day, right? You can still I still like my jollof rice being a Ghanaian. I still like that. So I make sure I eat that. But always making sure to just try to live a healthy lifestyle, balance your diet because not there's no, they talk about anti-inflammatory diets and I think the jury's still out on that a little bit, but in the end, it's if your body is healthy, it's going to be you're going to function much more. You're going to deal with your chronic illness a lot better if your body's healthy.
And we are going to round it out with our friend, Dr. Rosado. So you were one of our patients on the panel. So we want to check in with you, see how you're doing. So how are you currently managing your OA?
Good question. I've answered some questions in the chat about this just based off patient perspective, not giving medical advice. So I'm putting that disclaimer out there for people that were asking about OA specific treatment and management. So one way that I've tried to manage OA is trying to maintain a healthy body weight. Not necessarily trying to get down to skinny mini, but just watching that scale because those extra pounds creep up on your joints. So just finding that what's healthy for you. And also to everyone's point here, finding your active lifestyle. Your active lifestyle. Arthritis is not, living good with arthritis is not a destination, it's a journey. So finding your way of staying active that makes you feel good to reduce those symptoms a little bit. And one way I have been able to do that is through running, surprisingly. I don't run every day. I'm not running a full marathon, but I pick, good places to run at, even surface, and depends on the day. Some days I can't, some days I can. And I'm not sprinting, I'm doing a little jog, just getting the heart rate going. And so that has been helpful for not only my OA and staying active, but for my mental health throughout that dissertation journey. So
Absolutely. All righty, guys. So we are going to go ahead and wrap up. I want to say a sincere thank you to every single person on this panel. It has been so meaningful, like we said, to see myself on a screen, so many wonderful educated professionals. And I genuinely hope that this has felt good for your soul as well. So thank you guys. Those of you that are participating, thank you for joining. You will be able to see this on YouTube. You can replay it, share it, reference it back. Some upcoming events. We have another webinar happening in May. We have one every single month on a different topic. Next month is the Advances in Arthritis Care. That is going to be Thursday, May 23rd, right at this particular time. And you can always see our events, be it webinar or local, right there on arthritis.org. We mentioned those connect groups. We have one for so many different topics. We have one for OA happening actually next week. We have a podcast. So as you're driving, as you're riding your bike, as you're headed to work, dropping the kids off in carpool, listen to one of those podcasts. There's hundreds of them of tons of different topics. And we also have a helpline that you can call in with any of your questions. We have bilingual individuals there, but do know the foundation, we're here for you. Thank you so much. I'm Asia again. Talk to you soon.